Welcome back. I'm Dr. Cheek and I'm a licensed clinical psychologist. And today we're going to talk a little bit about two very common mental health conditions that share some very similar characteristics, but there are some very distinct differences that we need to also discuss as well. Now, we're going to be discussing borderline personality disorder as well as bipolar disorder. And both of them are commonly and incorrectly referred to as BPD. That's sometimes the nomenclature or the acronym that's used to discuss both of them. However, that's not the case. The suggested nomenclature, BPD, is indicative of someone with borderline personality disorder, while those with bipolar disorder are typically referred to as BD. So just to clear that up, BPD is borderline, BD is bipolar. Now, before we start to focus on some of the similarities and differences, I want to actually talk about each of the diagnoses separately. Now, keep in mind, I'm just giving some of the characteristics associated with both of the diagnoses. I'm not giving the entire criteria for either of these diagnoses. I'm giving just a snapshot of those indicators of either borderline personality disorder or bipolar disorder. Now, for borderline personality disorder, it's a personality disorder that's typically marked by unstable or sometimes chaotic interpersonal relationships, extreme mood fluctuations that are dependent on interpersonal relationship dynamics, are simply based off of what's actually happening in that interpersonal relationship dynamic. It's characterized by chronic feelings of emptiness, lower self-worth or lower self-image or self-concept, and it's also characterized by increased or elevated thoughts of suicidality or self-harm. Now, when we look at bipolar disorder itself is a mood disorder, and it's a mood disorder that's characterized by high highs, and those high highs are what we consider the manic or hypomanic symptoms, and the low lows, which we consider those major depression or depressive mood related symptoms. Now, when we think about those high highs, those manic or hypomanic symptoms, they could look like anything from an inflated sense of self-worth or a grandiose sense of self-identity. It can also look like engaging in risk-taking behaviors, a decreased need for rest, an increase in goal-directed activities, and that is an extreme focus on a goal-directed activity, and it's almost a hyper-focus on a goal-directed activity. And then we have the low lows. Now, the low lows are the depressive symptoms. So what that may look like is things such as depressed mood or lower self-worth, increased suicidality or self-harm, lack of interest in doing pleasurable or enjoyable activities, more likely to isolate and not engage with loved ones or family or friends. It may look like changes in your appetite, may look like changes in your sleep. You may sleep more. And those two different mood states, that high, that low, manic versus depressive, and what characterizes bipolar disorder is the transition between those two different mood states. Now, both borderline personality disorder and bipolar disorder commonly co-occur, which means that one individual can be diagnosed with both bipolar disorder and borderline personality disorder. It requires a skilled clinician to be able to assess if both of those diagnoses are co-occurring, or if one over the other, and being able to distinguish between bipolar and borderline personality disorder. And sometimes they can seem very similar. So these are some ways that they are similar. Like both borderline personality disorder and BPD feature risky or impulsive behaviors. They both have some element of self-harm or suicidality. They both may have a tendency to have self-image concerns. They both also commonly experience mood disturbances or emotion dysregulation symptoms. Now, the ways that they differ are very distinct and are necessary to understand. The differences are this. With borderline personality disorder, their self-image or their self-concept is sometimes in relation to an interpersonal relationship. It is based off of the dynamics of that interpersonal relationship. That's not the case with borderline personality disorder. Another way they differ is that they have different etiologies or different causes for the presentation or the development of either of these diagnoses. So for borderline personality disorders, most of the literature, most studies state that borderline personality disorder is a combination of innate temperament and experiencing childhood adversity, whether that's childhood neglect, maltreatment, or abuse. Those two seem to be the etiology for someone who has a diagnosis or carry a diagnosis of borderline personality disorder. Where with bipolar disorder, the etiology or the cause seem to be more inherited, which means that there is probably a family member or a close family member that has a diagnosis or carry a diagnosis of some type of major depressive disorder or a bipolar disorder themselves. So it's typically an inherited trait. The last way that they differ, and it's kind of similar to that first way that they differ, is that individuals with borderline personality generally maintain a negative or a lower self-image or self-worth for themselves, even in connections with maybe seemingly healthy interpersonal relationships. They may still have a lower self-worth or lower self-image. Whereas individuals with bipolar disorder, their self-image can fluctuate depending on their different mood states. So someone with bipolar disorder may have a grandiose or inflated sense of self-worth or self-image when they're experiencing a manic episode. But at the completion of that manic episode, that sense of self may be much lower. It may be a negative view of the behaviors that they engaged in while they were experiencing a manic episode, which may cause them to have a negative concept about themselves. And that same negative or lower self-image or lower self-esteem may be present during a depressive episode as well when we're dealing with bipolar disorder. And with bipolar disorder, what really distinguishes them sometimes from borderline personality disorders is that when the bipolar symptoms are remitted, which basically means that they're not presently symptomatic for manic symptoms or depressive symptoms, so that typically means that the bipolar is remitted. In that situation, their self-image, their self-concept, how they see themselves, their self-worth tend to be more reality-based, and it tends to be more stable and more positive in nature. They have a higher or more stable self-esteem or self-image of themselves. So that's the last way that bipolar disorder and borderline personality disorder differs. What I hope you take from this video is this: borderline personality disorder and bipolar disorder are very similar in their presentations. There are aspects of those two diagnoses that make them very different from one another. We talked a little bit about some of those, primarily based on their self-image or their self-concept, as well as how they engage in interpersonal relationships and also how they develop over time. All of those are differences in those two diagnoses, but there are a lot of similarities as well. But I also want you to be consciously aware that some of these things that I'm talking about in this video, you can experience. You can have multiple symptoms that I've discussed in this video and may not meet criteria for borderline personality disorder or bipolar disorder. If you have a concern or if you have a question related to whether you meet criteria for borderline personality disorder or bipolar disorder, I encourage you to speak to a psychologist, a psychiatrist, another licensed mental health professional to be able to get that diagnosis, to get that assessment, so you can be fully aware of what your true diagnoses may be. Are these individuals sometimes misdiagnosed? Yes. But those diagnoses can be corrected, and it's important because how we treat borderline personality disorder is different from the treatment for bipolar disorder, and that's why it matters. So, as always, I hope you take something from this video today that was informative, that gave you a little bit more insight into diagnoses and understanding borderline personality disorder versus bipolar disorder. I hope this video has been insightful and helpful and informational. As always, please feel free to jot down any thoughts, questions, or comments you have below. I thank you for taking the time to listen, and I'll be seeing you again very soon. Thank you.